Health, Nutrition and I with Ishi Khosla.
Just tell me how, Neerja, why science, literature, everybody talking about these microbes?
We harbor 100 trillion microbes, and these microbes are present in almost every part of the human body.
How they impact our health and well-being.
So 30% of the calories that we get from the food that we eat is actually because of the enzymes in these microbes. But 70% of the body's immune system is found in the intestine, in the gut. And it is the largest immune organ of the human body.
In my practice, I see the more obese, the worse their nutritional status is. Today they say that the gut is a second brain.
2/3 of your neurotransmitters are made in the gut, and these are determined by the kind of bacteria you have.
The happy hormones.
The happy hormones,
serotonin,
dopamine, GABA, all made by the gut.
There are people who are unable to digest this protein in wheat called gluten effectively, and it stimulates the production of inflammatory proteins in the gut, leading to a leaky gut and inflammations.
So prebiotics are simply food for the probiotic bacteria. Probiotic is bacteria which are scientifically tested to reach your gut alive. So today we know that these microbes can actually influence our mood. So whether it is stress, anxiety, happiness, all of this is determined by the microbes.
You treat your bugs well.
Please
and
do.
They treat you well.
Yes, absolutely.
Health, Nutrition and I with Ishi Khosla.
So welcome to Health, Nutrition and I. And today we have Dr. Neerja with us. Dr. Neerja Hajela is the head of science and regulatory affairs for Yakult and Danone India. And it is an absolute privilege to have you with us to talk about something which is so very important and yet so very small. Just tell me how, Neerja, why science, literature, everybody talking about these microbes. What is it? How, when did it start? And what is behind these microbes?
Thanks, Ishi. It's such a pleasure to be here and talking to you. Yeah, these microbes seem to be playing a very important role in our lives. We compulsively wash our hands, we clean our homes, we squirm when someone sneezes on our face, and we do all of that to get rid of microbes. But you'll be surprised to know that we are 10 times more microbial cells than human cells.
Yes.
We harbor 100 trillion microbes. And these microbes are present in almost every part of the human body, starting from the mouth, the food pipe, the stomach, the intestines, and even your intrauterine environment. The amniotic fluid and placenta are bathed with microbes.
That is really new science.
That is really new science.
It was all supposed to be sterile.
Absolutely. But in terms of numbers, there are 100 trillion. But in terms of weight, you'd be surprised to know they're almost 2 kilograms in weight.
Yes.
Much like the weight of the liver. So they are referred to as the forgotten organ. Literally an organ within an organ.
Yeah.
And all of this happened in the last decade, actually, when there were more sensitive techniques, to isolate and discover microbes. And then that is when we realized that we are so many microbes inside the human body. And these microbes are absolutely essential for almost every aspect of health and well-being.
So earlier we thought of microbes as some things which are just pathogens, as disease causing. But I think the whole narrative in our head has to change, that they are actually protective.
Yeah.
And we have to distinguish between the ones which protect us and the ones which cause disease. Is that right?
Yes.
And they say that we are born 90% human, and then we end up, when we die, we are 90% microbes.
Yes.
Tell us how they impact our health and well-being.
The largest numbers of these microbes are found in our intestine or the gut, and they're known as gut microbes. So right from digesting food that we eat to break it down to smaller molecules, being a nutritionist, you'll understand that the food has to be broken down into smaller molecules, and the nutrients are then absorbed by the gut. So 30% of the calories that we get from the food that we eat is actually because of the enzymes in these microbes. They digest those foods into smaller, easily absorbable nutrients, actually providing us with 30% of the calories from the food that we really eat.
Do they also trigger the enzyme secretions by the organs? I
Yes,
think that
with the kind of microbes that you
Yeah.
harbor, that our intestine is just not about digestion of food and absorption of nutrients, but 70% of the body's immune system is found in the intestine, in the gut, and it is the largest immune organ of the human body. And there are studies which were done with mice, where they saw that mice which had absolutely no microbes had a very, very poorly developed immune system. So these microbes actually are vital for the growth and development of the immune system. Not only that, many of these microbes actually produce vitamins, like your B group of vitamins or vitamin K, which is important for blood clotting. Some of these microbes are actually produce these vitamins. And
B12.
B12, and we know that B12 gets destroyed with cooking. So these microbes can maybe help in overcoming those deficiencies. 2/3 of the neurotransmitters are produced in the gut.
Yeah.
And these are also determined by the type of microbes that you harbor. So today we know that these microbes can actually influence our mood. So whether it is stress, anxiety, happiness, all of this is determined by the microbes.
You treat your bugs well.
Please
and they
do.
treat you well.
Yes, absolutely.
Health, Nutrition and I with Ishi Khosla.
So, Neerja, you're suggesting that our nutritional status, so whether we are malnourished or whether we are well nourished, depends on the microbial population that we have. That means if I am anemic, whether I'm osteoporotic or if I'm low in B12 or I'm vitamin D deficient or excess, these are the ones that we typically test for, could be rooted in the microbial balance.
Absolutely. Basically, what happens is today we know that in India, we are battling with the triple burden of malnutrition. We have undernutrition, we have hidden hunger, and we have, of course, obesity and overnutrition. Now, what happens is these microbial mix that you have in your gut is responsible for extracting the energy from the nutrients and storing the energy to be utilized further. So, while you may be having a complete meal, a well balanced diet, all the adequate macro and micronutrients, but unless and until those nutrients are digested properly, the nutrients are made available to the body, that food or nutrition has little or no meaning.
So we are really talking about malabsorption.
Malabsorption.
Here.
So
there is no dearth of perhaps the nutrition, the food. Yeah. So we have food security, but nutrition
deficiency, basically.
Insufficiency.
And by insufficiency. Yeah. Whereas, while this, of course, there are many other factors also, but today with emerging science and new knowledge, we know that these microbes play a very, very important role in helping the body assimilate nutrition from the food that we are consuming.
Can we also say metabolic diseases like heart disease, diabetes, degenerative diseases, maybe even aging, Alzheimer's? The entire spectrum and the big C, of course.
Yes. Interestingly, I was just reading a very recent review, and we know that India today is also transitioning from a communicable to an NCD, non-communicable disease country. And almost 7 out of every 10 people suffer from metabolic disorders like your type 2 diabetes, obesity and cancer, and name it. So interestingly, a study showed that when you consume a diet which is very high in fat, the consumption of this diet actually allows for the growth of a typical bacteria which has a toxin or a poisonous substance called lipopolysaccharide. Now, when there is an excess of lipopolysaccharide in the gut, what it really does is it disrupts the intestinal wall. We know that the intestinal wall is just one cell thick. And when there are holes, or leaks in the intestinal wall, all your undigested food, your harmful bacteria, your toxins, poisonous substances can actually enter into the circulatory system. They allow for the growth of these harmful pathogens.
Yeah.
The lipopolysaccharide, so to say, the toxin.
So we're talking about microbes and the
lipopolysaccharide.
One of the
toxins.
Metabolites is LPS.
LPS.
And there are many more, which ultimately lead to inflammation and the leaky gut. And so I would rephrase that. So microbes which are harmful for us will cause the leaky gut and then inflammation, and then inflammation is a trigger for almost every
Insulin
disease,
resistance and everything.
whether it's
We're talking
obesity, whether it's underweight, or whether it's the spectrum of all the
Overnutrition.
diabetes. Yes.
Yes.
And as a matter of fact, I must say that in my practice, I see the more obese, the worse their nutritional status is.
Absolutely.
They are so deficient in almost all the micronutrients that one tests for.
Absolutely.
So it's really not about the quantity or the calories or whatever you're having. It's about what it's doing to your microbes at the end of the day.
Absolutely. At the quality. The
Yeah,
quality.
so you're what you eat and
You
you're
are
what you digest.
Yes.
Health, Nutrition and I with Ishi Khosla.
We talked about mood. Tell us about how these microbes, the brain is up here, and today they say that the gut is a second brain. How does this work?
So this whole connection between the gut and the brain is actually not new. It was proposed in 1910 by Dr. George Porter Phillips. He saw that when depressed adults consumed lactic acid bacteria, some of their symptoms improved. And in the last decade, again, we've now heard about the gut brain connection simply because we're being able to isolate those microbes, And there are studies which have shown that it is these microbes which help in the development, the function, and behavior of the brain. 2/3 of your neurotransmitters are made in the gut, and these are determined by the kind of bacteria you have.
The happy hormones.
The happy hormones, serotonin, dopamine,
dopamine.
GABA, all made by the gut.
Melatonin, which is the
Melatonin,
big
yes.
one these days.
Yes. So the gut and the brain are connected by the longest nerve of the human body, which is the vagus nerve. Why is it that we get butterflies in our stomach when we are nervous or excited? Or why does a stressful event result in an episode of diarrhea? Clearly, that is the gut-brain connection. So the gut can actually speak to the brain, and it is through these neurotransmitters that the gut microbes can actually decide whether you're going to be happy, you're going to be anxious, you're going to be stressed, or unhappy.
Yeah, they say if there is one signal coming from the brain to the gut, there are 8 from the gut to the brain.
Absolutely.
Yeah,
Absolutely.
that is
and there are studies, which have shown that people who have, all these neurological disorders, mental health basically, depression, Parkinson's, Alzheimer's, sleep disorders, their gut microbial composite, the type of bacteria they have in their gut are very different from the healthy people. So clearly there is an increase in the harmful bacteria in the gut for those people who have these kind of disorders.
So at a practical level, Neerja, how does this work in terms of if I have depression or I have a mental disorder, how do I go back to my gut? I'm going to go to a professional to seek counseling, and maybe I need a psychiatrist. Is my psychiatrist or my counselor aware of this? And what am I supposed to do?
Onset of depression is multifactorial. It's not just one factor.
But the biggest factor is the
Your gut
microbe.
microbes. Interestingly, the gut microbes, they're dynamic, they're fluctuating, they're different. You and I have very different microbes at this point of time. And they can be influenced by almost anything, whether it is diet, whether it is sleep, whether it is your lifestyle, whether it is stress, whether it is the use of antibiotics. All of this can disrupt the gut microbiome.
And the vaccine.
And the vaccine, there are studies which have shown that there are subtle changes in the gut microbiome when you got the COVID vaccine. And all of this, when they change the gut microbiome, it's now the very, very technical terms like dysbiosis, and everybody wonders, what is dysbiosis?
Yes, tell us.
But dysbiosis is nothing. It is just an increase in the harmful bacteria in your gut and a decrease in the good bacteria, which are absolutely essential for digestive health, for your immunity, and also for mental health.
So, why is this science not reaching our professionals?
So basically,
what I'm saying is our treating professionals.
Treating professionals, because I'll tell you what, there are laboratories which are conducting microbiome tests. And this is helping healthcare professionals to actually evaluate, enhance, and track gut health. And they're using very sensitive technologies for determining the kind of microbes you have in the gut. But this is still in its nascent stage. So, you're still trying to understand what the differences in the gut microbes, what kind of implication they can have for health, and what could be the treatment options. So, it is still in evolution, and there is no definite kind of a recommendation that if you have a particular kind of a gut microbe, you require this kind of a treatment. So it's still a lot of evolutionary stage. But trust me, Ishi, I think like we do our blood tests today for diagnosing different diseases, in the times to come, it'll be our gut microbes which will tell us what we are suffering
already there are two
from.
things.
Already, yeah.
One is, of course, I can share with you my experiences with my patients who have depression or who have anxiety or who have panic attacks and other sleep disorders. And they're on medication, and shifting their diet from maybe a pro-inflammatory diet to an anti-inflammatory diet with gut support and probiotics, we're able to just get them off their meds. We can get them off to, being a normal, absolutely functional human being. And some of these people are actually non-functional, and they're unable to, do their work, go to their offices or colleges, and they just come back. And giving them probiotics, generic. I'm not even talking of gut testing. I'm not even talking of specific probiotics for the brain or anything. Just generic resetting of the microbial health is, and of course, nutrition is important.
Yes.
And we ensure that we make up for the deficiencies. But the results are dramatic. I mean, and in a very short span of time.
Like you said, spoke about probiotics. What are probiotics? These are those good bacteria that are needed by the gut, So probiotics, the term itself is for life. And these are bacteria which are scientifically tested to reach your gut alive in very large numbers and increase the good bacteria in the gut.
Outnumber
the harmful bacteria in the gut. So probiotics and prebiotics or symbiotics, all these terms are now becoming very popular simply because we know that most of our problems are associated with the gut.
Health, Nutrition and I with Ishi Khosla.
But coming to you, Ishi, I've been reading this book, Is Wheat Killing You? So how would you link wheat to, now we also talk a lot about the leaky gut. So
Yes.
how would you link wheat to a leaky gut?
Well, actually, wheat has fed the world for thousands of years. And I don't think anyone with a rational mind logically would accept the fact that wheat can kill you.
Yeah.
But the thing is that there are parts of wheat which we call gluten. There are people who are unable to digest this protein in wheat called gluten effectively, and it stimulates the production of inflammatory proteins in the gut. One of them you mentioned, and lipopolysaccharides, then we have zonulin. They cause the bacterial balance to go off, and they cause what we call dysbiosis, leading to a leaky gut and inflammation. So these people actually get sick with having gluten, which is a part of wheat. And earlier, there was, this association is about since almost 100 years now. And these people were called celiacs. So there was a very typical damage to the villi or the architecture of the gut, which broke down to what we call villus atrophy. And those people got well when we removed this protein from their diet. And their symptoms were very diverse. It could be gut-related symptoms, diarrhea, or it could be just a skin rash, or it could just be an autoimmune condition. It could be iron deficiency. One would see other nutritional, micronutritional deficiencies. They could be underweight. They could be overweight. They would have a belly, sometimes a protruding belly. There could be growth failure in children. So that, if the spectrum is from 9 months to 90 years, then it's a genetic predisposition. And you may have the gene for it, but it may express itself
very differently
later in life or very early in life, as soon as you introduce wheat. So there is no, it's a multi-system, multi-symptom disorder.
Oh, that's why when you go to a gastroenterologist today for a gut-related disorder, they always ask you to get a celiac test done, right?
Yes, yes. So there are red flags, and sometimes it's asymptomatic. You have it and you don't know you have it, but it is killing you inside, because if it is not treated, so that's the important point here. If it's not treated and if it is not managed, first if it's not diagnosed and then treated and managed, it can lead to serious health problems, including malignancies, which sometimes we find out much later. This is a particular kind of damage done by wheat. However, in the 1960s, I think we all know that, and there was the new variants of wheat which were produced to feed more people, so high yielding varieties. And that was done with a very good intention. But I think wheat being an immunogenic grain to some people, that means it is has the ability to trigger an immune response. When we meddled with that, the new chromosomal changes that happened in wheat made it far more immunogenic. And that is affecting almost everybody. And if you really see the chronology of events that have happened, post 1960s, 20 years later, after the introduction of modern wheat in our diets, particularly in India, we've seen the epidemic of obesity and then diabetes and then, of course, coronary artery disease. And today, we're not being able to cap anything, whether it's deficiencies, nutritional deficiencies, or obesity, or now cancer. And so obviously this modern wheat has disrupted our microbiome. And of course it takes three things to really trigger a disease: a genetic predisposition, an environmental trigger, and of course a leaky gut.
Leaky gut. Interesting.
Health, Nutrition and I with Ishi Khosla.
Hi Ishi, hi Dr. Hajela. I am Renuka. I'm 47-year-old and I'm a parent coach by profession. My question to you is, what do you think has been the impact of COVID and the vaccine and antibiotics on our microbiomes? Yeah, thank you.
That's a good question. So basically, a lot of people who suffered from COVID actually had gastrointestinal disorders. Many of them complained of diarrhea, vomiting, nausea. So while, of course, COVID-19 was largely a respiratory infection, but a lot of these people also had gut-related disorders. And there have been some studies which have shown that the COVID-19 patients had much higher numbers of these harmful bacteria that we're talking about in the gut, as compared to those who did not get COVID-19. Also, COVID-19, the vaccine, there's a bidirectional communication. So there are studies which have shown that the type of microbes that you have in the gut can actually impact the efficacy of the vaccine. The more good bacteria you have, the more effective is the vaccine. And, the association between COVID-19 vaccine and the gut bacteria is actually bidirectional. The COVID-19 vaccine had significant impact on the type of microbes, on the composition of the gut microbiota. And the type of microbes also determine the efficacy of the vaccine. There are a lot of studies which have shown that, the type of bacteria you have in the gut can actually influence the efficacy of the vaccine. And you also asked me about antibiotics. Antibiotics have largely been used for treatment of bacterial infection. So while these antibiotics can actually target your harmful disease-causing bacteria, they also impact your good beneficial bacteria. And what typically happens when you take a course of antibiotics, you end up with diarrhea, which is known as antibiotic-associated diarrhea. And the long-term consequences of use of antibiotics is that it can result in allergies, obesity, metabolic disorders, asthma. So these are all linked to, use of antibiotics.
Health, Nutrition and I with Ishi Khosla.
So, Neerja, we keep hearing these words prebiotic, postbiotic, and symbiotic, of course, probiotics. So, tell us the difference between all of them.
So prebiotics are simply food for the probiotic bacteria. They are foods which are not digested in the small intestine. They reach your large intestine in an undigested form and serve as food for the good beneficial probiotic bacteria.
So, let's go back to what is a probiotic.
Probiotic is bacteria which are scientifically tested to reach your gut alive. Now, most of the bacteria, whatever we consume, the bacteria are killed in the stomach because of the harsh gastric acid in the stomach. But probiotic bacteria are scientifically tested to be able to withstand that, or tolerate the gastric acid and reach the gut alive in very, very large numbers and to give you a scientifically proven health benefit. And symbiotics are nothing but a combination of probiotic and prebiotic.
Oh, okay. And postbiotics.
So postbiotic is nothing but the end products of probiotic bacteria. They are metabolites. They are not live bacteria.
Which are also useful.
Which are also useful. For instance, butyric acid, butyrate is a very, very, well-known postbiotic. It provides energy for the colonic cells and it's a very important postbiotic.
Would you not call lactic acid a postbiotic?
Yes. Acetic acid, lactic acid, which are produced by bifidobacteria and lactobacillus, they are also postbiotics, but they are not live. They are not microorganisms, so they do not essentially grow in the gut.
But they may create an environment for the flourishing of the good
So we
bacteria.
have, the science is in its very nascent stages. We have to really understand how they're going to work. Yes.
So when you say scientifically proven health benefits, so obviously curd, we know it's beneficial, but it may not qualify as a definition of the scientific term probiotic.
So curd is a part of our tradition. We have it as a part of our daily diet and we've been doing this since ages. Excellent for nutrition, excellent for your calcium, vitamins, minerals, all of that.
And lactic acid.
And lactic acid also. And so people who are lactose intolerant can tolerate curd better because lactose is digested and converted into lactic acid. But the lactic acid bacteria which are found in curd are killed in the stomach. So they're destroyed by the stomach acid. So essentially the bacteria do not reach your intestine alive to, grow in the intestine to create that favorable gut environment and thereby give you scientifically proven health benefit. Curd
But
is
traditionally we've always used curd
Yes.
to when you have a tummy issue particularly.
100%.
So there must be some benefit which
100%
comes out
because
of it.
curd is very easy to digest. So compared to milk, curd is much easier to digest. So curd is definitely a very good source of nutrition, easy to digest, but it does not classify as a true probiotic. And therefore in the market, if you see today,
But we also have probiotic curds, which have
Exactly.
been inoculated.
Exactly,
with,
but you have a curd and you have a probiotic curd. So
Yeah.
the curd does not have the probiotic bacteria. The probiotic curd is the one which has the benefits of curd as well as the probiotic
very
bacteria.
important point.
Health, Nutrition and I with Ishi Khosla.
Congratulations, Ishi. Hi, Dr. Hajela. I'm Gurvinder. I'm an academic working in University of Delhi. I'm 50 and have 2 children. Regarding street food, I like street food, but lately I have restricted myself a lot. My question to you is, how to build a healthy gut microbiome?
So we was talking about probiotics, prebiotics. They are not the panacea for a healthy microbiome. It has a lot to do with what we eat today. You'll be surprised to know that your gut microbiome can change within 24 hours based on the diet that you consume. So a well-balanced diet, a healthy lifestyle, which includes adequate physical activity, adequate hours of sleep, using antibiotics very judiciously, and an active lifestyle. I think these are all factors which will help the gut microbiome to be healthy and strong. And of course, if you incorporate a probiotic, prebiotic, or symbiotic, that is just a icing on the cake.
Health, Nutrition and I with Ishi Khosla.
So Ishi, we've been hearing a lot about food intolerance and food sensitivity. Been always confused about what's the difference between the two.
Well, food intolerance and food sensitivity are almost the same things. There's no difference, but allergy is different.
Okay,
Most
food
people
allergy.
tend to use the word allergy, which is technically a different entity. It is mediated by the IgE forces rather than the IgG in food intolerance. And essentially, allergies are about acute events like, you suddenly have a stomach ache and suddenly sneeze and suddenly cramp and suddenly break into a rash for a few hours, and after a few hours of ingestion of the food. And within a day or so, it's supposed to vanish. It should not be there. But it is very different when it comes to food sensitivity. Food sensitivity is a much more delayed sort of impact of ingestion of a food that doesn't work for you. And the delay can be like immediate sometimes, but almost up to 2 to 3 days.
Okay.
So it's very difficult for people to make those connections between what they ate 3 days ago or 2 days ago and what's happening to them then. So that's why it's called a delayed food intolerance. And the test is also called a delayed food intolerance test. And the effect is very, very different. And it could be something which is a digestive disorder. You could be having constipation, diarrhea, heartburn, GERD, any of those typical problems with digestion. Bloating is one big one. And belching and all those symptoms. But in more than one, more people, the impact is outside the gut. So you could be having just maybe a mood disorder. You could be having a skin disorder. You may be just losing hair. It could be an autoimmune condition. So anything which is bothering you, which is a chronic condition, can be associated with food intolerance, which is outside the gut. Like we just spoke about mental disorders, those are manifestations which have nothing to do with the gut. And a lot of people say, oh, I have an autoimmune condition, but I actually have no gut problems. So do I really have to worry about a leaky gut? The answer is yes. If somebody has multiple sclerosis and they say, you're okay on the gut, but the point is it's not visible to you, but the damage is happening, the inflammation is happening outside the gut. So that's how they are different, and their tests are different. We don't have very good tools to document food intolerances. We have fairly decent tests for eye allergies. And for celiac disease, we have now very, very good tests. But each of these tests, whatever you do, requires clinical validation and interpretation. A food intolerance test can be hugely overwhelming with many, many reds which appear, and people just wonder what's wrong with them. And mostly the comment is, oh, I eat this every day. How can I be...
Suddenly.
Yes, the point is that because you eat it every day, it is being partially broken and entering your leaky gut into the bloodstream, evoking the immune response. And that is why, it's telling you that it's now causing inflammation, because it's going in a partially undigested form into the bloodstream. And also allergy tests and have other implications, which sometimes, there are cross reactions, molecular mimicry. So we shouldn't get into this space without having a qualified professional helping.
Health, Nutrition and I with Ishi Khosla.
So Ishi, going back to calories, being a nutritionist, recently ICMR, the National Institute of Nutrition, had brought out the plate for the day, clearly indicating how much of carbohydrates, proteins, fats, vitamins, minerals, fiber and water we need to have, as a part of our daily diet. What are your thoughts on that?
Let me ask you a question. When was the last you counted your calories, carbohydrates, proteins, etc., on your plate?
Not so easy. Not so easy.
Can I say never?
Actually, never.
Let's be honest about it. And let's not treat food so complicatedly. It needs to be simplified in ways where people can make sense of what we say. These are tools for professionals, for labels, and for other parts of our functionality. But in terms of guiding people to eat well, to eat right, these are going to fail. I mean, we already know that. How many apps have come and gone? How many people have counted calories in the gym? and that equation doesn't work. So really the calorie cookie has crumbled. And one needs to understand food as food.
Food groups,
so
maybe.
Food groups at best, when we say vegetables, fruits, carbs, which means cereals, and we have the proteins and the lentils, etc. So we use those as easier ways of communicating. And yes, a half plate rule is a great tool, so that you at least say half your plate should be vegetables and fruits, and the rest should be divided in the other food groups, like I mentioned, the proteins and the the cereals, etc., etc. So it's a very easy way of visually understanding this. And ultimately, if you're trying to eat right, everything matters, just not this. It means what you're eating in terms of the choices that you're making, right from making the right choices of grains, what grains you're putting in, what are the inflammatory grains that you're putting out. So everything related to what, then how much of all those. So just because we're removing certain grains, it doesn't mean that we take the alternative grains in excess. So how much? Portion control for everything.
I think moderation is the key.
So if you're doing fats and proteins in a keto diet, you can't do that. It's just excess. So how much of what you're eating, how you're eating, are you dividing it into 2 meals, 3 meals, how you're dealing with your food, and how you're chewing. So those habits, how you're eating is important, and when you're eating. When you're eating is something which is now being recognized, and people are saying dinner by 7, we are over and done with. Yes. So, and intermittent fasting is one example where you have time restricted eating. But the whole thing is, you cannot oversimplify things. And I think the time for personalized nutrition is here, and we need to customize diets to each individual's needs. Having said that, we do need to give out public health messages. So for that, I wrote in my book, The Eating at Work, to help people deal with this question, what should I eat? So I made it like the 5P formula, the 5P step to managing your food. And the first P is really planning, that you cannot have a shortcut here. You need to focus on when you're at work or when you're in holiday or whatever, you need to plan your day with respect to food, because you plan your clothes, you plan your time. So it's a very important prioritize yourself with respect to food. And the second is peak hunger time, which means everybody has a time and a body clock, but just ensure that you address the time when you're most hungry, simply because if you don't address that, if you push that time, so most people feel hungry between 4, 5, 6, 7, and they usually don't plan that time, and then they end up eating much more, or they eat junk because it's not planned. So peak hunger time must be addressed. And then the third P is proteins. Be more protein centric than carb centric. Traditionally our diets were carb centric, and for good reasons, but today I think we need less energy from carbs, and we need to focus on good quality proteins. So at least 2 meals should be dedicated to proteins, which should be paired with vegetables. That's a fourth P. That pair your proteins with vegetables. If you're taking dal, take vegetables. If you're taking eggs, have some fruit or some veggies with it. If you're taking chilas, have vegetables. So essentially pairing your proteins with vegetables and fruits is important. And lastly, protective foods, which in our dictionary and our vocabulary, we understand protective foods as foods which protect us from diseases. They help fighting diseases, the phytochemicals, the phytonutrient foods. So those bioactive compounds are present in vegetables and fruits and in probiotics and in sprouts and live food, fermented food, and of course our spices and supplements as well. So dedicate 1 meal to protective foods at least. So it could be a breakfast of just fruits, it could be a lunch of just salads, or dinner with just vegetables and soups. So that should be primarily 80% of that meal. And the rest, of course, can be paired. I think it can't get simpler than that. And grains, the carbs, should be decided as per individuals. Like I said, personalized. I may need grains in 3 meals, I may need grains in 2 meals, I may need grains in 1 meal, or maybe none certain days. So that's a personalized approach.
Oh, that's fantastic. Good to know. Yes. I can go on and on asking you many more questions about food, but I don't know if we have the time, and
I think let's
maybe we might have to move on to the next one. Yes. Thank you, Ishi.
Thank
Lovely
you,
having
Neerja.
you.
Thank you for being with us.
Thank you.
So thank you for tuning in for Health, Nutrition and I. And we'll see you in the next episode with Neerja Hajela once again.
Health, Nutrition and I with Ishi Khosla.